So good morning, everybody, and I really appreciate being here today, and appreciate the invite from the Chilliwack Child and Youth Committee. I was actually looking at the acronyms there, the CYC, and when I started out the F.O.R.C.E, we had no money, so we couldn't have employees, so I had to start my own little business in order to start doing some of this work, and my business was CYC Consulting, so it's funny to see it here today. I'm going to talk about when Rob invited me to come out here, and we kind of talked about what's the important thing that people want to hear about here, and the important work you're doing. And we decided that nothing about us without us resonated. It certainly resonates with me. It's really why I got into this. And I got into this because I felt like families are more than a site of intervention. Families are a core of our community. Our young people are the core of our community, and we have to find a way to reach out to them. And my son is why I'm here. And I'm not sure, it's hard for me to see his, I've got his picture. I'm not sure how we'll go through there. I'm not sure how we'll go through the slides, but so the reason I'm here today is because of my son. This is a picture of him at 9 years old. Whenever I speak, I start with him because he's why I'm here. And I think the nothing about us without us and the context of engaging young people is that it starts with experience. And everyone in this room has experience. What I've learned to value is that my experience as a parent is of value. And I don't need to be a clinician. I don't need to have the expertise that other people have, but I have expertise as a parent. And there were often times when I didn't feel like my expertise was in the room. And without my expertise, I felt very separate from my son's care. And I would imagine that listening to the young people that we connect with now, often the same is for them. They have experience in their own life, and they have an expertise. And I think there's a value in us reaching out and really listening to that expertise, and not just saying we're listening to it, but to actually listen to it. So we started, when I started the F.O.R.C.E in 2000, it was with another mom. And she saw me on Global TV because I came out of Children's Hospital, and I thought, I waited 9 months to get in here, and I can't seem to find any other parent to talk to. And the other groups I went to, they all had parents, but they were parents of adult children. And I thought there's got to be some other parents out there. And I also thought the services have to be better than what we've just received. Because as all of you will know, you've been through it, you go from a tertiary care and you go back into community, and often the plans that come with you as a family or a young person can't translate to services in the community. And then everybody is feeling like, what do we do? So that is an important piece of why I founded the F.O.R.C.E. And I wanted to I think the important piece is for families. I didn't come out swinging. I didn't come against the system. It wasn't about making the system feel bad about themselves, because my feeling is, what do we gain about making people feel bad about themselves? I have never met a parent yet that we help them by making them feel bad about themselves. And we make sure that we try to, when we talk to people that work in the system, come from that place. My family was in a desperate situation. We already felt like somehow we were at fault for my son's problems. I didn't need somebody else to say that to me. I met the psychiatrist at Children's Hospital, Jana Davidson, at a conference in my early days. And she was early as a psychiatrist. And she had an expert speaker come up to talk about early onset bipolar disorder. And the room was full of 400 clinicians. And the woman was talking about refrigerator mothers. And I was in the room. And I thought, And I looked around the room, and someone put up their hand, and they said, well, Dr. Geller, can you tell us, as clinicians, what should we do then when these refrigerator mothers bring their kids in? And I thought, oh my goodness, there's going to be 400 people walk out of here believing that somehow every kid that walks through those doors that might be bipolar, it's because the mother is a refrigerator mother. So I put my hand up. And, you know, at the time it seemed like the right thing to do, but after I left, I thought, I don't know how I did that. But it's an important piece, that evidence, and at the time there was lots of evidence that supported that term. But I think that there's evidence that we haven't even come to know yet. And I think that evidence comes from our young people and our families. And I see a lot about evidence-based practice, and I think we've got a long way to go for that. So along the route of nothing about us without us, so the next slide is a Latin term. And luckily, in the last few weeks, I've been helping my daughter with some of her papers for school. And we were writing a paper about nothing about us without us. And I came across the Latin term for that. And while it came into, and I don't know that a lot of people would know this, but the term nothing about us without us came into our language in the 1950s because of the disability movement. So people with physical disabilities didn't want things said about them without them. So they came up with this term. And it was what they said, it was an activism that communicated that no policy should be decided by any representative without the full and direct participation of members of groups affected by that policy. And really that's the underlying work of the F.O.R.C.E. For me, it was like a lot of people are making decisions about my son, and all well-intentioned. Nobody was out to judge our family. I don't think so. I like to believe that there weren't judgments. Maybe there were. I'm sure that everyone had lots of education and experience that they were bringing to the table, but there were a lot of things being decided without us. And to me, there just seemed to be something wrong with that, and that's why I started the F.O.R.C.E. It actually reminded me a lot about the women's movement, because the women's movement wasn't about supremacy. It was about equality. And I see the nothing about us is really about equality. I just wanted to have an equal voice in my son's life when I was sitting in care team meetings. I remember the first meeting that I had my first ICM, and there must have been 15 people in the room, and my husband and I walked in. We'd only met 2 of the people, and the principal from our school wasn't invited. And so the meeting started, and everybody introduced themselves, and there was a knock on the door. And it was the principal from the school who my son had just thrown a desk at 4 days earlier. And I thought, when he came in the room, I thought, oh my goodness, he's going to be kicked out of this school too. Here's the principal walking in, and this is not going to be good for our family or my son. And the principal just said, I just want to say one thing, and I'm sorry for interrupting the meeting. He said, I just want everyone in this room to know this family has tried harder than any family I've seen come through the doors of my school. And he goes, I don't want this family blamed for where their son is right now. And my husband and I, in that meeting, it shifted the whole meeting for us. It didn't matter whether we knew anyone else in that room. Someone had said we weren't bad parents without saying it. And from there on, it didn't matter to me that I didn't know those people in the room. But they at least knew that I wasn't a bad parent. And I see a lot of parents who feel really, really bad about themselves. So with in the progression of the F.O.R.C.E., I was in a meeting in Ottawa a number of years ago. And it was with the Mental Health Commission of Canada. And I realized that the Commission, in their efforts to do something with families, they weren't including families of children, which, of course, Mike Kirby calls children's mental health the orphan of the orphan, because it is. And I left that meeting in Ottawa, and I thought, you know, I really think we need a national organization for families. So I heard about a woman down in the States called Sandra Spencer, and she heads the National Federation of Families in the States. So I went and I met her, and it turned out that we were going to have our first Child and Youth Mental Health Day in Canada, which I don't know. Somebody asked me the other day, where did that day ever come from? And I turned to them and I said, me and another mom were sitting downtown having a coffee, and we said, how come we haven't got a National Child and Youth Mental Health Day? And we looked at each other and said, I think we should do one. And we said, well, let's pick a date. And we literally, this was 2006, and we said, well, let's do it one of the days in the Mental Health Week in May. And we said, well, next year's 2007. Let's pick May 7th, 2007. And we literally created a national day. No one's ever told us we couldn't. No one's ever acknowledged it federally, but we did it. And you know, this is the 7th year now. And I think what it proves is that there really aren't obstacles. You know, the obstacles are when we take our eye off our goal. And our goal was to raise awareness for child and youth mental health in this country and engage young people and families. And Sandra, when I met her, she said, are you kidding me? She goes, May 7th is our Child and Youth Mental Health Day. We did not know that. And she had this green ribbon. And she said, how would you like to take the green ribbon to Canada? I said, bring it across the border. So we, literally, the two countries, that's how it started. And I think the thing is it's the grassroots. And this community, Chilliwack, the Fraser, the work that's done out here, I talk about this community and this region wherever I go in the country. You guys are doing some pretty remarkable work out here, which I'll show some examples of. But one of the things that when I was thinking about the women's movement in similarity to the family movement, now this is a very small slide, this one coming up. What I'll do is I'll send it to Rob, so that to the committee, and maybe they can distribute it. But it shows the milestones of family movement from like the 1900s. And it is, you can't see it. It's pretty remarkable where it's come from. Literally people being not involved at all in their family members' care, to where the New Freedom Commission in the States has made it so that agencies, if they don't have parents employed and they don't have young people employed, they don't get access to the systems of care funding. So it's something that we're thinking about. And one of the things that down there, they call it family-driven care and youth-driven care, but we decided we were going to call it Family Smart here. We like the term Family Smart. It means that we would like to think about what practices would make something smarter than it is right now. So we have trademarked that, and we're working on it. We're hoping that it will influence research, policy, and practices in this country. And there's a spectrum of family engagement that I want to talk about, because there's some work that we've been doing recently as a province. And it has been moving people from being at one end of a continuum, which is where we inform young people and families. So that's where we'll just give them handouts. We provide information to them. We're informing them. It's good. Then we move to consultation. I've seen lots of focus groups, lots of surveys. We do those things with young people and families. It's how we have gotten to know how to engage them. It's an effort to engage them. Then we move to involvement. You know, we do workshops. We do workshops with them. We do workshops for them, mostly for them. A lot of things developed for families are still developed not by families and not by young people. And collaborate. We have advisory committees. I'm on lots of committees where there's either a family member or a young person, but it hasn't gotten to the real decision-making further upstream, which is where we want to move people to. We want to move them to empowerment. And when we move people to empowerment, we're talking about that being family smart practice. And we're really talking about where there's shared decision-making, and we start to look at outcomes that matter to young people and families. Because lots of time I look at outcomes, And I'll sit with families, or I'll sit with my kids who both have mental health challenges, and I'll say, does this matter to you? And they went, no, this doesn't matter to me. And I said, so how come that's what we're measuring? Why aren't we actually finding out what indicators of success are to the people who we're trying to do it for? So we definitely want to move to the place, and you'll see more of this coming out through the province through our 10-year plan. You're going to see where there's going to be some real dialogue happening about moving us from informing to empowering. And I was quite surprised by some of the early discussions where people didn't even want the word empower. And I thought, that's where if I'm going to stay on this committee, we have to have the word empower. So it's been an interesting process here in this province of where we got to, because you have to think about the F.O.R.C.E started in 2000. That was 13 years ago. And 13 years ago, we were in a very different place. And we have really moved. We've moved from where we are. And I really do believe it's because of some of the efforts of the people in the system who want to work with young people and families. And they reached out to the F.O.R.C.E. And the F.O.R.C.E has been accepted in a way, and parents and young people have been accepted in a way that's allowed us to move this. I want to give some local examples, because some of the examples that I've seen are tremendous. And again, when I go and I speak about it in other places, people go, how do you guys do that? And I said, we just do it because people are willing to do it. We're willing to do it. And I wanted, one of the things that I was wondering about, and I wondered out loud, and I put it on here, was the Scott Miller tools. And I don't know, I know some about it, but I've also been wondering how much we're actually using those tools with families. So not just the person sitting in front of us, but are we using some of those tools with families to see what's changing for them, and not just the young person who we might be helping. There was a pilot in Burnaby a couple of years ago where, like doctors' offices, they phoned families to remind them about their upcoming appointment with child and youth mental health. I think that the non-show rate dropped by something like 60%. It was it was a simple thing, just phoning families and saying, remember, you've got this appointment tomorrow. We do it for other health areas, but we don't do it in that one. That was an interesting survey that they did. The ICM, or wraparound. Now, I just want to say, when ICMs are done well, they're great. I've seen lots of ICMs that are not done well. And I think that there has to be a commitment to wraparound and to ICMs. There has to be supervision for them. There has to be training for them. And years ago, when this province actually put money into child and youth mental health, we were able to do some of that. And then for 3 years, child and youth mental health almost disappeared. And it had a deep impact in all the people working in child and youth mental health, and the training and the support they needed that had been hugely invested in and then dropped off. And ultimately, the children, youth, and families were impacted because of some of those decisions. And collectively, I think we need to make sure that we can move on that. The parent, youth, and residents, which I don't know, some of you will have some knowledge of the F.O.R.C.E's parent, youth, and residents. But again, that idea came from the States with Sandra Spencer. And she said in her early days when her son was 5, and she had a social worker come to her house, because they said, we're just going to come into your home and show you how maybe you could parent different. So the social worker came into her house, and they were doing a little bit of going through the different supports that she had and some of the strategies she used with her son. And so the social worker said, I'm just going to spend a little bit of time up here upstairs. If you could just go downstairs, and then we'll call you. Anyways, she heard this scream about 20 minutes later, call 911. It was the social worker. The child was doing exactly what the child did with the mom, and was doing it with the social worker. And the point was Sandra Spencer didn't need parenting tips. She needed support. and she wasn't getting the support that she could do. And that's not to say that all parents don't need parenting. We could all benefit from parenting. It's just, it's been a little bit of the default that if we just fix the parents, we'll be good to go. And I can tell you, I'm not an exceptional parent. I've never pretended to be. People look at me and they think, you know, oh, you couldn't have kids like that. They also have a certain image of what parents will look like that have kids with mental health challenges. They look like me. They look like you. They're amongst us. We are us. and it's an important piece that I want us to shift to, because I never want another parent to have the pain that I had with my son. My husband texted me this morning because my son's getting his wisdom teeth out. He's 24. But developmentally, he's had a really tough life. So he's 24, but he needs us to take him to his dentist appointment because he still can't drive. So my husband texted me and said, it reminds me of elementary days, dropping him off. Only today there was no issue. When my son was little, we were told by experts and evidence. They came and they printed out evidence for us that my son just had separation anxiety, and it was because I had over-mothered him. So they said, you just have to bring him into the building, and we're going to hold him here, and you leave. My son never forgot that. And they did the same thing in the hospital to him. That was evidence. So this is very personal for me. and I love that there's rooms like this, because I also say many of you are either young people or your families and your parents. And this could be you if it's not you. And I have a very strong belief that what we can change is the things that are the most important and the things that we actually have in ourselves. If we come out of what we've been told. And it's good training. They're important training, but there's a piece here. The other thing I wanted to talk about was the incredible opportunities Rob Lees has given us. Critical incident reviews. When I tell other communities that we actually sit on critical incident reviews when there's been a suicide, they say, you guys sit on there? Well, what do you bring to the table? I said, what does anyone bring to the table? We're bringing to the table that we are families, in many cases, whose kids have either had the challenges, but also some of us have worked with those very families that have lost their children. And we're there to bring a perspective. And that's what it is. We're not trying to say that we have something you have. We have what we have. And it's an important piece. And then the journey mapping. I had a parent last year create her journey, where she had started with her son at 5 and where he got to at 15. It was astounding to see how many points of entry their family had been to. And that wasn't uncommon for families in this province. It was the points where we missed opportunities were profound. And it landed them in a place that's not a very good place. And I wonder how many journey, if we mapped every family's journey in this province, it'd be quite an interesting story. One of the other things that the F.O.R.C.E has worked a lot on, and we've been able to have the privilege, and this is a privilege, is to go and speak to people and actually create workshops. Create workshops. Rob invited us into the University of the Fraser Valley to come and speak to some of his students who were going to be going into the field that many of you went into. But we came in and talked to them about us as families, because they're not going to learn that from the textbooks. We actually came and spoke to them about it. And we want to be partners, and we want them to come into this field feeling that there's value in being partners with young people and families. I always like to say that families don't fail. Families don't fail. Our plans and our supports fail. So if we're looking at what it is we want to put our attention to, I think we better be looking at our planning and our supports. Because when families are given what they need, almost every family can succeed. I said this earlier. And obstacles are those things we see when we take our eyes off the goals. I say that because I remember a parent called me one day, and their life reminded mine of what mine was 8 years ago. And she said to me, Kelly, don't honestly know what to do. And I said, so if you could have anything today, what is the most important thing for you today? She goes, I wish I could walk out of my front door and my neighbors wouldn't look at me like I'm some pariah. She goes, they don't want us living here. Nobody wants us in our community. She goes, that's all I want. And I thought, I wonder if any of the planning that's going on for her has talked about that. Her kid can't go to a rec center. He can't go to a school. Has anyone actually asked what their family wish is? What's the goal for them as a family? And when we were able to get some support for her to go through that, she said it was probably the most important conversation their family had together since their journey began. Because they had everybody else's goals on where they should get to, except their goal. It was a profound day for her. I like to say this one. One of the things that I have felt a little bit like in 13 years is that, we could have gone outside the system in our advocacy, and we probably could have moved faster. But our piece about advocacy is it's not about us moving faster, it's about us moving together. And we want to come alongside the people that are working in this field. We want to come along the systems that are responsible for this. And I think that when families come alongside and we do go together, it's going to take a while. But I know that we can get there. So I'm going to go back to the women's movement because I laughed when I saw this. And, although we've come a long way, we got a really long way to go too. And it reminded me of an old ad in the 50s with the women's movement where they said, you've come a long way, baby. And it doesn't necessarily ring true back then for a lot of women, and it doesn't now. And in fact, as I said, some of them would say we haven't come far enough, and don't call me baby. There's kind of, I did a talk a few weeks ago, and I said, the new F word has got to be families. We got to get comfortable with it. And it is, although we've come some way, it's not a time to rest. It's not a time to rest. It's actually a time to really think about what we're doing, how we do more of it, and if we want to know what we should be doing, turn to the people who we're talking about. They've got lots of ideas. And the reason that they sometimes don't speak up, they also have not felt like they've had the power to do it. And because they're so entrenched in the life that we have to live with our kids, we also sometimes don't know what we know, and we don't know what we need, but we need someone to kind of have a conversation with us so that we can explore what we need. And I know lots of that good work goes on. I like to always show them where my son is now, because people often ask me. When a kid starts out at 9 years old and talks about taking his life, you don't always know that child is going to be an adult. And so people often ask me where he is and how he is. And I can tell you that he would not be here without some incredible programs. The day treatment program, for one, I can't say enough about that. They came to our home. My son wasn't going to go to an office. He didn't want to go to see a therapist in an office. They came to our home. They saw how we lived. They talked to my daughter. You talk about residual impact. My daughter. So by them doing that and by them wrapping around our family, it saved him. It saved our family. Because ultimately, we have the confidence as families, as parents, that we can actually take care of and help our son. And I think when we can build confidence in families, then we don't need to be, our job isn't to do their job. Our job is to make sure they can do their job. And I think that when we do that, that really is going to create the kind of system and the kind of community that I can see is pretty strong here in Chilliwack. And the committee, Rob and I talking about, you know, look at who you've got on your committees. Look at how you engage. I was in Toronto yesterday and got back last night. The dialogue all over this country, how are we engaging youth and families? We all know we have to, and it's a really big job. And I think that you've got some real examples here in Chilliwack that you could share with the rest of the country. And we're really hoping that we're a vehicle to be able to share some of the best new evidence, new evidence on really what's going to work for children, youth, and families. So I thank you very much for the privilege of speaking here today. And I'm speaking on behalf of us. So the nothing about us without us. I am the us, but I also think you're the us. And I very much look forward to watching the new and amazing things that Chilliwack comes up with and seeing how we can help you and to promote the great work out here. So thank you.
Tim Bohr from Chilliwack Youth Services. Kelly, we were intrigued by your reference to a refrigerator mom. And the thing that was going through my mind was the football player, the refrigerator Perry, and I'm sure it wasn't referencing the size of the mom. So if you could maybe explain that.
Sorry, sorry about that. I usually go into more context about what refrigerator mother. It was a term coined by an expert from Boston University, who said that refrigerator mothers, so when she said refrigerator mothers were at the root cause of children who were showing up and getting the diagnosis of bipolar disorder. So in other words, the mothers were cold. The mothers were unfeeling, cold, detached from their kids, and therefore that produced bipolar children. And I had never heard it either. But I thought, wow, everyone's leaving this room today thinking that I'm sitting here as a mother, and I don't know if I didn't think there was any other non-professionals in the room, but I thought, wow, everyone's going to leave here and think that every mother that walks through that door is cold and unfeeling. And I'm thinking, I don't know anyone that would describe me like that. But that's how I'm now going to be clinically coined. And I didn't see how that would help me or my son.
We were just wondering about self-care. Like as a mom who struggles with that, that's something when working with at-risk youth, that how can you promote self-care for these families that there isn't a lot of support for the families just to get away from their kids for a little bit?
Yeah, I think one of the things is interesting in every single consultation that's taken place in this province and other provinces, respite is the #1 thing that families want and never get. And we keep asking them, what do they need? And they keep saying respite, and it's like we take that one, we throw it off the list, and we go to everything else. There is a tremendous role. We were just talking at our table. If the kids are not wanting to go to the appointments and they're not wanting to seek the help, then we better see if we can help the people around them who are trying to help them, and that is often mums. And I, for one, lost my job. So now you've got no income, you've got a kid that won't leave the house, you're now solely responsible. And as I said, it's not the families that fail, it's the supports and plans that fail. And so I think that communities can wrap themselves around families. And it's one of the things that reminded me talking at our table was a discussion in Toronto yesterday, and Kids Help Phone, and the huge amount of kids that are phoning Kids Help Phone. And they want to put more money. This funder said, well, maybe we'll just put more money there. And I finally had to put up my hand and go, is nobody bothered by the fact that we have so many kids phoning Kids Help Phone? Don't we want to do something to bolster communities and families to be able to support these kids rather than have them phone a line? I said, put your money there. Support communities and families. That's the piece for me. You're right. You're many cases in our homes, you're left to handle this. And it's just not right. And so that's the piece that we advocate for. To me, that's family smart practice. Let's really put something behind family smart practice and start bolstering the people who are literally trying to handle this all on their own, and sometimes not even have enough money to get a meal on the table. Not so helpful.
Hi, Kelly. My name's Carmen, and myself and all my lovely coworkers work for the Chilliwack Society for Community Living. We're just wondering if you could maybe give us a little bit more detail about the journey mapping that you spoke about, what that all entails.
Sure. I know that health regions have done some journey mapping with patients, and there was actually some money that took and did journey maps for young people who were transitioning from foster care out of the system, and they did journey mapping with them. The difference was they had the system doing the journey mapping with them. We actually sat with the parent and we did the journey mapping with them. And it just really was marking down every point of contact that they had been in. And we were able to, and which system that service was in. So we were able to see how many systems this family's doors they went into, and how many services within a system this family had tried to access. And it really was, when we saw how many ministries a family has to walk through, profound. As we all know, we don't have a seamless system. But when we did that journey mapping, it also told the story, and it allowed that family to see what they've been through and what that young person has been through. And it was quite therapeutic. And it allowed us to say, okay, so where was something really great, and where was something where we had an opportunity that we really didn't capitalize on, and how could we do it differently for the next family? Yeah.
Dan Bibby, MCFD. I'm just wondering if we could speak a little more about the parent and residence. I was telling our table about it, what a fascinating program it is. And
sure, okay. Yeah. The parent and residence, when the F.O.R.C.E started, we called ourselves support and resource coordinators, and we were parents who reached out to other parents. And then when I went to the States and met with Sandra, and she had told me that she had a role down there that she called herself parent in residence, because she was actually in the university and in the clinical settings. And so they would actually come to her and ask her to speak to not only the parents coming along, but also speak to the people working with parents and young people. So we were able to get Fraser Health and Vancouver Coastal Health to come alongside and create more parent and residences within the F.O.R.C.E. And I believe we have over 20 parent and residences now throughout the province. And I can tell you, being in Ontario yesterday, they like to talk about all the great work they're doing. Not one of those agencies has something like the F.O.R.C.E in Ontario. And that the government helps pay for those positions, and that so do private funders like RBC. They see the value in it. They're interested in funding it because they also believe we need to start bolstering people in our communities. And our parents are in our communities. And then we got the youth in residence. So we were able to hire 2 youth in residence to work at a children's hospital. That had never been done either. And they're helping develop the websites there, all the youth outreach tools. It's the real deal. It's not just tokenism. And I think that's the beauty of the parent and youth in residence, is that the system is supporting those. They realize the value in it. And I think that communities that have had interaction with the parent and youth in residence, they see the value. Because keep in mind, we're actually taking some of the pressure off the system if parents have another person to connect with because they can't get into your service. And sometimes that can change a lot of dynamics in a home, when we've had that parent feel like they're supported. And it can change that for youth who don't want to go and see somebody that's clinical. So it can be a really, really good way to take some pressure. I always say to myself, I can't believe that all the parents who are on wait lists are not connected in to the F.O.R.C.E parent and youth in residences. It's there for them while they're waiting. And let me tell you, lots of them don't even know what they're waiting for. But they get in the queue because that's what they've been told where they're going to get service. And we often can get them out of that queue because what they really needed was somewhere else, or we were able to bring them out of crisis. That's the beauty of the parent and youth in residence.
knows me.